with 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 every virus, with actually every infection, there is something called the incubation period, guys. Incubation period. Okay. All it takes is for you to be exposed with one virus. One. It's like a cancer cell. You only need one cancer cell. You only need one virus. So if you get one virus or two viruses, or into your nose or your respiratory tract, there's an incubation period where there is no test, zero. No test will pick it up. It doesn't matter if it's a nasal, oral, blood, antigen. It doesn't matter. During the incubation period, there is no test that will pick up the virus. Okay. That incubation period, pay attention, can be 14 days, up to 14 days. That's why we've been telling you guys to quarantine for 14 days, because statistically speaking, it's not like suddenly the 15th day you're all clear. But for the most part, after 14 days, statistically speaking, most people will be clear. Now, the average incubation period is 5 days. 5 days. That's average, right? So from the time you think you were exposed, that's also the other problem. That's also the other problem, is that you don't know exactly when you were exposed. Oh, my coworker tested positive. Well, when was the last time you saw them? This was the last time, but that doesn't mean you were exposed at that time, And remember, the CDC calls exposure close contact for 15 minutes with someone who later tests positive. It's 15 minutes. I know they've talked about dropping that guideline to even 10 minutes shorter. All right, we got 4 more minutes and then we'll read my test. Okay, so there's an incubation period. The average is 5 days from exposure, right? During that first 5 days, no test is going to test positive. So that means you get something called, so this is the main topic. What we're talking about tonight is this: false negatives. That means you have tested negative, but it's not accurate. Your PCR, your nasal, your antigen, your oral, your blood, which I just took, it's still, you actually have the virus in you. It's just too small to detect. This is very similar to when we say to patients with cancer, we tell them you are in cancer remission. We rarely ever, we really, doctors really don't say you are cured of your cancer. We actually say you are non-detectable, right? We can't detect your cancer. You are in cancer remission. So nobody should ever say I'm cured of cancer, because and cancer starts and it only takes one cancer cell. So you're never cured. So it's similar to that, which means given our testing models, we can't detect virus. So it's possible during that first incubation period. Remember, incubation period is from exposure, day 0, to up to 14 days. The average is 5 days. Average is 5 days. We can't detect you. Okay. Now, false negatives. So that's about 100% false negatives. It's crazy. Now, that rate, after you start having symptoms, here's the key. And this is the problem. You have to start having symptoms. This is what's really fucked up, right? By the time you're having symptoms, cough, feeling bad, especially loss of taste and smell, which we will talk about in another video, because I need to talk about the flu season, cold viruses, things like that, because we're seeing allergies. But symptoms matter. Once your symptoms start showing up, then the false negative rate drops. So that by day 2 of symptoms, your rate of false negative has dropped down to like 30%. By day 3 and 4, the more it goes, it drops down lower and lower and lower. By day 4 or 5 of having symptoms, it's like 20% false negative, but you still have a false negative. You can still have false negatives like 5 days into having symptoms. Why, Dr. V? Because if you do a nasal or a throat swab, they can miss the virus. You can have virus in you and they miss it. So some people comment, like have been saying, have you noticed the article about like the tweet, Elon Musk, I tested like for coronavirus and 2 tests were negative and 2 tests were positive. What the hell's going on? Well, Elon Musk is smart and he has smart people around him and they will explain to him. It depends on what test. He never said what test. Is it an antibody test? Is it an antigen test? Is it a PCR test? And it could have been a combination of all of those. He might have done an antigen rapid test, which we'll talk about here in a second, which is can have a high false negative rate, right? Or one would be negative, one could be positive, and then they retest with a PCR, which shows positive, and then they could have retested with an antibody, and he hasn't formed antibodies yet, which could be negative again, which then explains your 2 and 2. We just don't know the story. It's just people are jumping to conclusions, right? So symptoms matter. If you have symptoms, the longer you go with symptoms, the false negative rate drops, but it never goes to 0. This is crazy. And it doesn't matter which test, okay? So let's talk about the test real quick. Number 4, there are 3 types of tests. Currently, okay? And it doesn't really matter that it's coronavirus. It could be any virus, but it's molecular, antigen, and antibody. So molecular is the one that most people are familiar with. This is the one you shove up the nose, put in the throat, and you're looking for DNA material. So genetic material. I misspoke. Genetic material. If it's a DNA virus, you're looking for DNA. If it's a RNA virus, you're actually looking for RNA. So coronavirus is actually an RNA virus. So in this case, the molecular test, the one they shove up your nose, it's looking for RNA. So it's a PCR. It reverse transcriptases. It reproduces it. Okay. Now that takes special equipment. It takes time. It takes a lab. And now with this pandemic going fuckity fuck crazy here in America, you're going to see what happened back in April, which you're going to have huge testing lines, huge turnovers. Who remembers back in May when there were videos of long lines of cars? In fact, comment now if you're in Wisconsin or one of these hot areas where there are long lines of cars and they are testing thousands and thousands of people in Dodge Stadium there in LA, Chicago, Wisconsin, and you're having to wait hours, right? And then not only once you get tested, now they have to send this to a lab. Well, labs have employee personnel limitations. It takes time to run the test. You can't, it's not like dropping a solution, reading the test, by the way. It is literally, oh, I got my results, hot damn. And it is actually like, it takes reagent. You could run out of reagent. It takes time to run the machines. It takes people. You got to mail it back. And yes, there are apps. You could pay extra for an app. Not everybody wants to pay extra for an app. They can message you. They can email you. But there are rules and regulations against that. So that's what you're doing when you're talking PCR and stuff. Now, the PCR ones are the most sensitive ones. That means they will detect the virus at the lowest level, right? They're the most sensitive. They're the ones that we rely on to pick up the virus. Problem is they still have false negatives because you can miss the virus. You can miss here, miss here, miss here. So there's no telling if the tech who did Elon Musk missed the virus. I mean, you just don't know, right? Maybe if it's a self-test, you didn't shove it up far enough. The tech didn't push it up far enough. You squirmed, you jumped, you gagged, and they couldn't get a good sample, right? So there are false negatives with the molecular. The antigen is actually checking for proteins. Proteins are what the DNA makes. So it's not as sensitive as the DNA, I did it again, right? The genetic material, it's not as sensitive because you're still waiting for the virus to start producing proteins, and that's what you're detecting. with an antigen. Now you can do the nasal antigen, oral antigen, and then the saliva test that you've heard about. Now the saliva test, very inaccurate. Why? There's a lot of shit up in here. Human mouths are nasty, y'all. You know what you did last night. Come on. You know what you did last night. Last night was Saturday. You know what you did. There's a lot of shit in that mouth. It's nasty. In fact, your mouth is nastier than a dog's mouth. If a dog bites you, if a dog bites you on the hand, we wash out your hand. We give you some antibiotics, stitch it up, send you home. If you get into a fight or someone bites you, fuck. Now we got to wash it out, stitch you up. We admit you to the hospital and we put you on IV antibiotics because the human mouth is nastier than a dog's mouth. So now you understand why the saliva test, like, it's just give me the fucking saliva, give me the test already. You know how hard that is? How many different bacteria, the crap, and oral cavity, and you got cavities, and you got shit, you got rotten gum, stank mouth, you got all sorts of crap going on in there. Don't lie. You know what you did Friday night? Got a little strange on the side? Come on now. See, aren't you impressed? You're probably like, how the hell did he know what strange is? You guys know what strange is? You get a little strange on the side? All right, so mouth is nasty. So the saliva tests are very inaccurate, but they're detecting antigen. Now the antibody test, the one that I just took, the one that I put together in my rapid test, this is a blood test. You saw me prick my finger. I put it in the cassette and put in some buffer solution. I don't need a special lab. I got results in 10 minutes. It's actually been 15 minutes. I can read the results. Ready? I can read them as soon as 10 minutes, up to 15 minutes, and after 25 minutes, they're invalid. So I made these cards for you. We're going to read my test. What we want to see for a negative test is just the control line. No IgM, no IgG. Okay? So here we go. Drum roll. How did Dr. Vuong test this week? Ta-da! Still negative. Still negative. So let me show you what this means. The IgM are the first antibodies that come up. So if I had a pink line by IgM, y'all see that? If I had a pink line under IgM, that would mean that my body is actively trying to fight off this infection because it's the first new antibodies that come. The IgGs are what we call the memory antibodies. That would be the second line. And the IgGs show that we've had past infections. So this test will pick up for active infections as well as past infections. Now, but Dr. Vuong, on the CDC, I Googled it, I looked at this, and it's not used for active. Well, because I'll tell you why. It depends. First of all, if you've decided as a country, as an organization, that you've partnered with these labs for this PCR stuff, which one are you going to push? Are you going to push the test that you've partnered with to promote? Or are you going to push the antibody test? No, you're going to push the PCR test. And I've already said it detects it at a lower level. But even that first 5 days, it still has false negatives. Just like any antigen test, antibody test. During the incubation period, no test will be positive. Okay. Now, the antibody, why, Dr. Vuong, then do they not use the antibody test to show active infection? Well, mostly because you have to have an immune response. See, the other tests, you just have to have virus in you. With this, the host, me, I have to be young enough and healthy enough to have an immune response. So if you are, for example, on a cancer treatment and you are immunosuppressed, or you have arthritis, or you take a medicine like Humira that suppresses your immune system, you might not have antibodies because this test is checking for your antibodies. On the other hand, if you're relatively healthy, you're young, and you've been tested in the past, and you've been able to demonstrate that you have an immune response, then you're good to go. You can take this test, right? Understanding that any test in the 5 to 7 day window period, incubation period, will show up negative. Now, let me ask you this, because some people are like, well, then we just need the PCR to test positive. What's going to happen? Do the math with me. You have a 5 day incubation period. Then you start having symptoms, right? So now, and then you kind of, well, maybe it's cold, maybe it's allergy. So now you're waiting. Let's say you wait 2 days. Let's say you're a wimp. Let's say you're a wuss like Dr. V, and you wait 2 or 3 days before going to test yourself. So now you're at day 7 or 8. You go in a line and you get tested. And now it takes 4 or 5 days to get results. Now you're at day 12, 13, in which case you could have just stayed at home and tested yourself. But Dr. Vuong, I need to know why if I'm positive. Why? Well, because I don't want my other people to get sick. What's it matter? The whole time you're going to have to isolate. If you think you have coronavirus, doesn't matter what the test says, you should be quarantining at home. Make sense? Yes? Give me an amen. Yes? Your ass should be at home quarantining. Oh, well, you're not going around like, oh, I might have coronavirus. I'm still going to go to the barber shop. I'm still going to go shopping and I'm going to cough on everything. What type of asshole are you? If you're sick and you're not feeling well and you're coughing and you've lost your sense of taste, you're staying home and waiting for the test. So if the test takes 4, 5, 6, 10 days like it did in May to get results, what the fuck's the point? You could wait till day 7, 2 days after having symptoms, 3 days after having symptoms, and test yourself for antibodies. If it shows up negative, you have to be smart and say, well, maybe my body hasn't formed antibodies yet. And then retest yourself in a couple of days. By that time, you might still be waiting on your PCR test. See, we need more testing, not less testing. Does that make sense what I'm saying? So that's why I test myself minimum of every 2 weeks. Because, I'm young. I have a strong immune response. If I have allergies, I have a 4-year-old. She might come home with a flu or a cold, something like that. I have a 28-year-old girlfriend I love to kiss on. She works, we wear masks. We socially distance when we can. But part of the strategy is regular testing. Okay, so let's talk about Thanksgiving. So yes, it's possible to test negative and still have coronavirus. Okay, so now let's talk about what happens at Thanksgiving. If you want to do, all right, first choice. Remember I said this yesterday. First choice, no Thanksgiving. Now listen, I have to say this because some people are going to watch this video and get all bugged and say, oh, he said we could get together if we buy his test kits. No. Your first and best option is no Thanksgiving gathering, especially if you're in a hot zone. If you are in a hot zone, if you're in El Paso, if you're in Wisconsin, South Dakota, Salt Lake City, New York City, anywhere, if you are in an up and coming hot zone and you get together for Thanksgiving, live with the consequences because there's no difference between this and like shopping impulse. You understand it's the same thing. You got to have it. It's on sale. It's 20% off. I need a new pair of shoes. This impulsive behavior, it's the same base behavior, base meaning like root behavior that makes you want to impulse buy. I need to get together. It's Thanksgiving. It's the holidays. We have traditions. Dude, you can't put off instant gratification for a year because we're raging through a pandemic. Think about that. You are so concerned and worried about what other people are going to think, okay? But there are going to be some people that say, Dr. Vuong, my parents are old, my grandparents are 90, this might be our last time, we got to whatever. We want to get together, we're going to be smart about it, okay? So if you're going to be smart about it, here's what I would do. Second best choice is this. This is what I would do. Is this. Your second best choice, if you are unwilling to not have a get together, is quarantine plus test. You need to quarantine now. And by quarantine, I don't mean go out. I mean like minimal groceries. Some people would say no grocery store. but definitely not a restaurant, not a bar, not at your hairs, not your nails. You need your groceries delivered. You need to only go out if you have a doctor's appointment. You stay your ass at home. That's what quarantine means. And I recommend 14 days. Why? Because we just talked about at the beginning of the video the 14-day incubation period. It could last up to 14 days. So if you want to be the best, is quarantine for 14 days. Now, some experts will say that's enough. I'm going to tell you it's not fucking enough. You can believe me or not believe me. You can take your chances or not take it. But I would literally say 14 days quarantine plus a test. Now we are already past 14 days. We're at 10 days. So if you watch this video and you still want to have Thanksgiving get together, you need to say, hey, yo, 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 start quarantining tonight, right now. You'll hit the 10-day period. At a minimum, 7 days. Remember what I said. The average incubation period is 5 to 7 days. 5 days. Well, I'll just, because I don't want to bum y'all out. 5 days. So this Thursday will be 1 week before Thanksgiving. Okay. You're just, oh man, if you haven't stayed your ass at home, this means essential workers. I get it. You got to work. I understand. You have, some people who have to work. Some people, their job makes them go. Dude, stay at home. At the very least, you're going to have to quarantine plus test. So you can talk to your cousin, your sister. Hey, okay, you're an essential worker. How do we work this? Do you have time off? Do you have paid sick leave? What can we do? Can you have a vacation time? What can you do to have this quarantine period? And then we're going to do some testing. Either you sit your ass in that doctor's office, or you wait in line for that test for 4 hours. And hopefully you can get a rapid test for 10 minutes results, or an antigen test. Any sort of test is better than nothing. But Dr. Vuong, what about accuracy? What about this? What about, dude, any test is better than no test, right? What you're doing is layering protection. It's like a condom. You got to layer that protection, yo. And you've all had those nights where you kind of wake up and you go, man, maybe I should have used 2 on that one. That one was questionable. Maybe I should have used 2. More layers, the better. Okay. Keeping your clothes on during sex is the safest. Okay. Just kidding. Don't listen to that. Just ignore that whole last minute rant about sex. Anyway, use a condom. Okay. So you want to layer your protection. So we talked about this in yesterday's video. Quarantine plus test. Now, what do you do when you get there? When you get there, it's everything else is the same. So at the gathering, it's the same thing. Outdoors is better than indoors. Masks, social distance. Okay. Now, some people will say, but Dr. Vuong, we quarantined for 14 days. We all tested negative. Do we still need to have outdoors and masks and social distance? The answer is it depends. It depends on the level of risk you're willing to take, right? You're willing to take. If you feel good, if it's really, immediate family, all right, do it indoors. You can do it indoors and wear a mask except for when you're eating. You can do it indoors you can do it outdoors without mask and social distance. You decide. If you live in a good weather, if you're in Florida, Texas right now, it's 72 degrees today. It was like perfect weather. You can have an outdoor Thanksgiving without mask, social distance, elbow pump, whatever, right? As long as you quarantine and social and test, right? You have to decide ultimately what is your risk level. Some people are going to be like, it's cold outside. We're going to be indoors. We've limited it to immediate family members. We've all tested. That's fine. You have to decide. This is called adulting. We are quickly going to become adults. Okay. So, last tip. This one's important. Okay. Okay. You have to treat Okay, now listen, The mistake people are going to make during the holidays is number 8. This is super important. Number 8. Okay. If you are from a different family, you have to treat them like coworkers or strangers. You are not, you mean if I sat here and said, hey, let's have a Thanksgiving get together for all of work, you would say, that's stupid. This is a pandemic. Well, you have to treat family members from other family the same way. If they don't live in your immediate household, you have to treat them like coworkers or strangers. You have to sit there and say, do I really want to see my second cousin? Do I really want to see my aunt and uncle from another city or another state? No, I would say no. Some states are saying no more than 2 separate families. Like it could be, you know, you and your favorite sister decide to bring your little family together for a 6-member, 8-member family, 8-member Thanksgiving get together. They're all quarantining. They all had negative tests. We're going to be outdoors because we live in Florida or Texas or whatever. See, you're lowering your risk level. But remember, the number one safest way is to not have Thanksgiving. Just can't do it this year, guys. Okay. So, and yes, I understand a lot of people are, some people are have had, I mean, they've lost jobs, they're on fixed incomes, but I promise you, go sit in line for a test. They are not charging you out of pocket. Test now, they might, listen to me, I'll do another video on this. They might start rationing tests.